Hello, this is Dr. Sri Nagesh, lipedema specialist from India, based at Ojas Aesthetic, Hyderabad. Today we shall try to understand what uh, preoperative tests would be required before you can go in for a lipedema surgery. And so what happens is once you diagnose yourself having lipedema, or you suspect and you go to a healthcare professional and your diagnosis is lipedema, so then the process starts. So first of all, you need to rather than having a online consultation, a physical consultation would will confirm the diagnosis of lipedema overall, and the surgeon will have to do a comprehensive physical examination, uh, like start not only examine your entire body, your arms, your legs, thighs, your waist, uh, all these areas, the quality of the skin, the difference in the quality of skin in your chest, abdomen, thighs, lower extremities, upper extremities, there's a difference. So all these things, and along with that, they also check for other parameters which identify lipedema, which uh, clinically should get you the confirmation about the rice grain like structures or piece size structures, nodular fat, irregular skin with or without skin folds, abnormal deposits of fat in certain areas which are bilaterally symmetrical, spider veins, bruises, bruising, uh, the development of wrist cuff or ankle cuff. All these things, you know, are all indicators. And then sometimes some patients have uh, pain on without pressure, and some have pain on pressure in different parts of the body. And these all of these things have to be assessed, and then we come to a conclusion that it is lipedema, and then you're a candidate for the lipedema surgery, and know what stage you are in, what type of lipedema are you having, all these things, and we can plan the sessions that are required, and then comes the blood test. So we need to do a certain blood test, like you need to do a routine blood test, like knowing your blood counts, uh, knowing how your kidneys are functioning, liver is functioning, your electrolyte levels. These all things give us a general understanding about the general health of the individual, and so that we know if your hemoglobin is low, then the hemoglobin has to be corrected. Whether if the hemoglobin is low or if the hemoglobin is or is normal, sometimes you may also have, but still have a iron deficiency. So a serum ferritin test, or serum albumin or serum pre-albumin test will give an indication as to post-operatively whether you'll recover fast, or you're a slow recoverer. So these things, the doctor will evaluate and then decide what tests need to be done and what tests need not be done. And then you need to get a electrocardiogram, that is the ECG. So we understand how the electrical activity of your heart, so how it is functioning, whether it's normal or and your respiratory system, how it's functioning. You're able to breathe well. We have asthma or any other condition. These all things have to be evaluated. Once these are evaluated, then of course other diagnostic tests like imaging studies like MRI or CT scan to evaluate the extent of the lipedema. That is like in my previous video I had mentioned that the quantity of fat between the skin and the muscle can be assessed, and we're also trying to, the newer scans that are coming up, in the near future we may even be able to qualify the fat, whether it is normal fat or it's abnormal fat, and what is the percentage of abnormal fat that is there, that needs to be removed and addressed, so that the patient can fare better and get a better relief long term. So, what is the condition of the venous system? What is the condition of the lymphatic system? So, how to plan the surgery, how to circumvent these blood vessels and the lymphatic system so that we protect these conditions, these systems, so that patients don't get into trouble in the future because of surgery. So these are all the things which have to be looked into. Plus, of course, we need to have a baseline assessment like height, weight, then the circumference of each part of the body, so that and the parts of the body where we are going to operate upon, so that we know how much reduction in size has been achieved, and we can track the changes that are taking place after the surgery, so that on for long term follow up, how long you've been better, and whether the symptoms are restarting, and if they're restarting, how to control them at that area. So it's better to uh, you know address the situation in the early stages, so that you have a better long term disease free life. So the earlier you identify yourself and the earlier the stage and you undergo the procedure, the longer term you are disease free and symptom free, and uh, lead a more happy life. The later the stage, it becomes difficult not only for the patient, it also becomes difficult for the doctor to treat you. The number of surgeries that will be required may be much more. Sometimes you may even have to do, just not liposuction alone may not be sufficient. The water-assisted liposuction may not be alone sufficient to address the situation. So sometimes you may, because of the amount of skin laxity and this number of skin folds that are present, you may also have to plan excision of chunks of tissue and to tighten the tissue in that area, so that you get a toned appearance. So these are all the things. So the patient also needs to explain to the doctor any previous surgeries, any medications, any allergies the patient has, so that we'll be well prepared to avoid those things and give the patient a healthy and a problem-free uh, post-operative, intraoperative, and post-operative situation. So, also the anesthetist will evaluate your heart, lungs, and other situation fitness, and then decide the risk factor, whether you're minimal risk or a high risk, and depending on that, we'll have to also modify the anesthesia procedure as well as the surgical procedure, so that we give you the best possible outcome. Thank you. I hope you have understood all these details. And if you have any questions or doubts, feel free to contact us at our clinic, Ojas Aesthetic, Hyderabad, or also feel free to get to us, reach out to us online at www.ojasaesthetic.com or www.lipedema.in for more information and any other details. Thank you. Have a great day.